okay, parents, your kids are going to turn out just fine.
This episode of the Your Kids Will Be Fine podcast is brought to you by True Height. True Height is what your child needs to help them reach their full growth and height potential. It is not a magic pill that will make your child grow beyond their genetic potential, but what it does do is that True Height addresses the areas that can limit growth potential, especially the areas of nutrition, sleep, and stress. I use and recommend True Height products in my own practice because the ingredients are clean. They are well researched. They're backed by clinical trials. Kids in my practice love it. It tastes great. Even the picky eaters like it. For more information, you can go to the podcast website, yourkidswillbefine.com, or go to True Height Vitamins, that's TruHeight, trueheightvitamins.com. Welcome to the Your Kids Will Be Fine podcast. I am your host, Dr. Michael Malofsky, board-certified pediatrician, parent of 7, grandparent of 3, and this is the podcast where we talk about the overwhelming amount of information that parents have to sort through today when they make any kind of parenting decision to help you sift through the noise and help you know what's important and help you know that really most of the time your kids will be fine. So the topic today, circumcisions, definitely a concern for at least 50% of you. And this is an area where I am getting way more questions than I used to, and way more families feeling a bit confused about the information that they're reading and what's important and what's real and what to know. So let's get into it. The first and most important thing that is important for a family to know when it comes to the choice of circumcising your baby is that it is, at its core, it is a personal decision. You are going to be asked this when you check in to the hospital, when you're in labor, or before you leave with your newborn. You are going to be asked this multiple times. And oftentimes you're really tired and you're really emotional, and it seems like an overwhelming decision to have to make. So certainly want to think about it beforehand and ask questions. But the American Academy of Pediatrics, their official position on this is that there is no overwhelming or specific indication in a healthy baby that necessitates having to circumcise a baby. It is truly a personal choice. So let's talk about first the risks and the benefits. So the risks of infant circumcision, the usual complication rate, and you'll find this easily online. I think Boston Children's for Harvard Medical School, they quote a complication rate of around 2 to 3% of all the circumcisions done have some kind of complication. By far, the most common complication of a circumcision is bleeding. All babies get a vitamin K shot at delivery if you don't refuse it. And as we've talked about before, and you may not know, that not all babies are producing adequate amounts of vitamin K, which is a key factor in allowing blood to clot properly. Most babies are producing it by 7-8 days of life, but in the newborn period, in order to prevent serious bleeding problems in babies, which were very hard to predict and could be very devastating and were commonplace before we started universally providing vitamin K, we give a baby a dose of vitamin K at delivery. However, because of the differences in individual babies' anatomy and the differences in methods and perhaps operator experience, some babies, although very few, will have bleeding that needs to be managed or treated after circumcision. It can't always be predicted. However, I'm going to sort of offset this with some personal experience. So I've been doing about between 1 and 5 circumcisions a week for the last 20 years. And I know many practitioners who have been doing 10, 15 or more circumcisions per week for 20, 30, and 40 years. And for those of us who do this many circumcisions, the rate of bleeding as a complication is exceedingly low, far lower than the quoted numbers. I think it is way less of a concern than it's advertised. Other risks to circumcision is, of course, injury, meaning that through getting a circumcision, inadvertently, they can cause damage or injury to the penis or the head of the penis. And that is a stated complication, as I've said. However, I believe this is also very much operator dependent. And in in polling and speaking to the people who I speak to in my own experience, it has never happened to me. And for people who do this number of circumcisions on a regular weekly basis, that rate is pretty close to zero, if not zero. And then I think the biggest concern of complications around this is pain and suffering to the baby. And I think this is a legitimate concern. I think people are obviously, if you just had a baby, why would you expose your baby to something that could potentially be traumatic and painful? And I will acknowledge that this was, I think, a significant and big issue 20 years ago plus, when it was thought that babies did not experience pain in the same way that older children did. And this, as we know, is completely erroneous. Babies, newborns experience significant pain when exposed to painful procedures. And that's why if you go to any medical setting where infants are treated and where there may be pain associated with anything that they're getting done, there are several procedures in place that dramatically minimize and treat infant pain. So in the circumcision setting, let's talk about what those are. First is how the baby's positioned. All babies are swaddled tightly so they feel very secure. When I do circumcisions in the medical setting, though, the baby is on a board that keeps the baby extended in the legs, so I have better access to the circumcision site. I acknowledge that is an uncomfortable position. It's not a natural position for newborns to be in. However, I find that if you gently manage it and take your time, they tolerate it very well, and they soon forget about it. The second measure that is universally done to manage infant pain is that babies are sucking on a concentrated sugar solution. This has been studied over and over again as an important preemptive measure to reduce infant pain for any painful procedure, because sugar solutions release a lot of endorphins in a newborn's brain and significantly relax them and decrease their perception of pain. This does not happen when your baby is 4 and 5 years old during Halloween. It is not the same. It is newborn specific. And the third, and I think the most important measure, is that it is considered the standard of care that the babies get an injectable ring block to block the penile nerve at the base of the penis, and which dramatically reduces the baby's experience of pain during a circumcision. Some older practitioners will use topical anesthetic cream, which is considered an acceptable alternative. However, in my experience, I don't think that it is as effective in managing pain. And so in the circumcisions that I do, and I have done, when all these measures are taken, rarely does the baby experience any observable problems. The baby rarely cries, reacts about the same as they do to a diaper change. And I think one of the most important elements that is operator dependent in managing this part of it is how quickly and efficiently the procedure is done. In people who do the method of circumcision that I do, the people who I mentioned who have this high rate of circumcision performance where they do a lot of them, 1 to 2 minutes is pretty average for completing this procedure. There is very little time for the baby to experience a lot of any more significant discomfort or trauma under those conditions. So those are the major risks. So let's talk about benefits. The stated most important benefit in a healthy baby of circumcision is that statistically it reduces the rate of urinary tract infections in the first year of life. Now, although that's statistically a benefit, urinary tract infections in boys in the first year of life is already, in total, an exceedingly small number. So yes, circumcisions do reduce that number by a certain amount to an even smaller number, but you're talking already something that's pretty rare, and certainly not a reason that people should consider as a compelling reason to have to circumcise your baby or not. There are long-term studies in adults who are circumcised and uncircumcised in terms of rates of sexually transmitted diseases, rates of things like penile cancer, and there are some differences in favor of circumcision to reduce numbers of those things. However, I don't believe anybody with a newborn is thinking about or worried about or considering rates of sexually transmitted diseases or penile cancer as a reason to circumcise your newborn. So once again, risks are exceedingly low. Pain is very well managed and generally not a factor for most babies. And the benefits are there, but there is But the point is that on either risk or benefits, there is very little compelling reason to feel like you have to or not circumcise your child. So we get back to the place where it is truly a decision based on personal choice. The last one risk that I left out is the risk of infectious complications, so infection after circumcision. I have read about this. I see published rates of these types of things. I'm going to once again couch this with my own personal experience over 20 years of doing them, as well as the experience of my colleagues. I have never seen it. It's never occurred in the setting where I've done it. It's never occurred to any of the people who I know that do as many or more than I have. So I know it's out there. However, it's in such small, exceedingly small numbers, and I have never seen it. I think it's very highly unlikely. So now, talk to risk benefits. Let's talk about methods. There are 3 ways that most circumcisions are done, and you should definitely feel empowered as a new parent when you're in the hospital. You want to ask questions. If you wanted to get your baby circumcised, who's doing it, how many have they done, and what are the methods that they're going to be using? So the first method that I run into a lot, and this is in hospitals where they have people with different training levels and different experience levels doing circumcisions, is a Plastibell. A Plastibell has a very, very easy learning curve. It's not a complicated procedure. It doesn't require a lot of technical skill. A plastic ring is inserted under the foreskin and tied with a ligature. The foreskin is then trimmed around the top edge of the Plastibell, and the rest of the foreskin falls off slowly as blood supply is cut off from the suture tie. And then it says the Plastibell is supposed to fall off on its own. However, I have to remove a lot of Plastibells after a week or more when they're not falling off, often with great pain and discomfort to the baby. So Plastibell you will run into. I'm not a fan of the Plastibell. The second most common, and this is one I think is most common in most hospital settings, is the Gomco. Gomco, it looks like kind of an erector set, and a metal shield is put over the head of the penis, and the foreskin is pulled up over it, and then it's trimmed off. There is almost zero risk of injuring the penis. There is very low complication rate. It is done very frequently. The downside to the Gomco that I see, one is how long it takes. I've seen these procedures go 10, 15, or 20 minutes. I think that's just an unacceptably long amount of time to have a baby strapped down and doing a circumcision. I just do. I think it's too long. I know that many practitioners, once again, operator dependent, who do this a lot, have it down to much less than that, still 5 minutes or so. I still think that's probably too long. The only other downside to the Gomco is that oftentimes it can't really account for foreskin differences, and I see a lot of babies down the road who get circumcised in the hospital, perhaps by an OB, and they come back and they see me and they have a lot of extra foreskin, and it has to be redone perhaps when they're older. So those are the 2 downsides to the Gomco. And then the third method, the method I'm most familiar with, the method that I have been doing, and the one that is done by all practitioners who do Jewish ritual circumcision, or a bris, is a Mogen. A Mogen looks like a metal clamp, like a cigar cutter, and the foreskin is pulled and through the shield and then cut off. There is no suturing. There is very little bleeding most of the time. The issues with the Mogen are that it requires a lot more time and practice. It requires a lot more experience to have the outcome be consistently good in the way you want it to look. It just takes more time. There's much more individual craftsmanship, as it were, in how you do the procedure to different individuals for the optimal outcome. And the learning curve is a lot longer. It takes a lot more time. So you're going to see it a lot less in the hospital. I believe that the main advantages are, one, in someone who has experience and someone who does it well. The whole thing takes a minute. I'm not exaggerating. Your baby is mostly done before they really kind of even know if anything is going on, between the Mogen and all the other measures to control pain. And 2, I believe it has the least amount of bleeding. There's almost very little to almost none most of the time. So those are the big 3. I think that we've made it pretty clear that, to summarize, that it is a personal choice. There's no overwhelming evidence that you have to circumcise your baby unless your baby might have been born with a condition where it would benefit them from a health standpoint, but those are rare. I also think that the risks are mostly overstated. However, your outcome and I think your experience is very much operator dependent. The more a person does, the faster, the cleaner, and the least amount of problems you're going to have when you're making the choice to circumcise your baby. If you have any questions about this, don't forget to go to our website, yourkidswillbefine.com. Don't forget to check it out on YouTube, the YouTube channel, Your Kids Will Be Fine Podcast. Watch the videos, watch the podcast, comment. We always love to get new ideas from parents and families about topics they want us to discuss. And we are looking forward to seeing you next week.